I am really excited today to be talking to three thought leaders in the area of prescription drug affordability. And before we dive into this important topic, let's get to know the three of you. Vanessa, let me start with you. Tell us a little bit about who you are and your background.
Hey, Steve. Thank you for hosting us here. My name is Vanessa Borg. I live in Loudoun County, and I'm a community organizer for prescription medication affordability with the nonprofit group Freedom Virginia.
Great. And then, Vinny, how about we go with you next? Tell us a little bit about you and your background.
Yes, thanks, Steve, for having us. Glad to be on here with these wonderful Virginia folks. I'm Vinny DeMarco. I'm the president of the Maryland Healthcare for All Coalition. We have been around since 1999, and we enacted the very first in the nation Prescription Drug Affordability Board law in 2019, which we want to improve in 2025. And we hope Virginia will get your law passed soon, too. So thank you for having me.
Wow. Okay. And Irv, tell us a little bit about yourself. And I understand that you've got a personal story that you can share that might help lead us into this discussion.
Thank you very much, Steve. I'm a 73-year-old retired person here in Fairfax County, Virginia, and retirement is wonderful, but it brings other issues. And the issue I've had is that while I was working and under private insurance, my wife and I, various issues that I had and medications were all very well covered by private insurance. But that changed when it went to Medicare. And there was one drug that I have had to take that has been very expensive, and I moved from a $5 copay to as much as $1,000 per injection, which I took 4 times a year. That kept increasing, and I was looking for relief. Where would I get it? I got it through the Inflation Reduction Act, because in that bill, it did two major things: negotiated with drug manufacturers, but also put a cap on copays. So now my story is, instead of paying 10, 12,000, whatever in copays, now I'm limited in this year to 3,200, and next year will be 2,000. That is what the power of legislation can do. It has helped me and every other person who's on Medicare, who must take these awfully expensive drugs, have all been protected. And it's just wonderful. And I wish I could just shout it from the rooftops.
Well, this is amazing. I mean, when you're talking about the dollar value that you were spending and now what you're spending, and we hear stories about people cutting pills and sacrificing food for their prescriptions. And I want to help shout this from the rooftop as well. I imagine that there's people out there right now that can benefit from what Irv discovered, but they don't know where to go or how to do it. Am I correct in that?
Yes, so we love what the Inflation Reduction Act was able to do for people who are on Medicare, but we want to bring that savings to the rest of our people as well. We know we've done studies in Virginia about 1 in 4 people have struggled with being able to take the medications that they need due to cost. So this is a really pervasive issue, but it's one that we don't talk about that much. And it's one that we are pushing a prescription drug affordability board to help fix and help set those fair cost caps.
Great.
Yeah, this is great. And what Irv said was really wonderful. And I want to thank President Joe Biden and Vice President Kamala Harris for enacting the Inflation Reduction Act. And it wasn't easy. Big Pharma fought it tooth and nail. The original prescription drug part of Medicare had a provision in it that prohibited Medicare from negotiating with drug corporations. And it was put in there by a guy who then became the head of Big Pharma. So it didn't conflict with his interest. But that has been in place for decades. President after president has tried to fix it, but only Joe Biden, Kamala Harris were able to do it, which is great. But as Vanessa said, we need to expand that to everybody. And we hope it could happen at the federal level. Vice President Harris said she would expand the benefits to people not on Medicare. But at the state level, a prescription drug affordability board is the way a state can expand these benefits to everybody. We were the first in the nation to enact such a law in 2019. And our board is about to do its work and make high-cost drugs more affordable for state and local governments. That will be historic. And after that, we hope to pass legislation in 2025 to expand our board's authority to be able to help all Marylanders. I want to emphasize one thing, Steve, is that in addition to, as Vanessa said, about a quarter of people who can't afford their drugs, and drugs don't work if people can't afford them, all of us suffer when big pharma gouges us because our insurance companies pay huge amounts for these drugs. And if we don't see it at the prescription drug counter, we see it in our premiums. Our main insurer, Blue Cross, CareFirst Blue Cross Blue Shield, which covers parts of Virginia, says that a third of their premium costs are because of high cost drugs. So we all suffer when big pharma gouges us. And what is their defense? They say they need these high prices to fund research. Not the case. We did a study showing that the 10 biggest drug corporations in 2022 spent $20 billion more on profits and advertising than on research. And Senator Chris Van Hollen has put in a bill to say that when the federal government pays for your research, you can't charge whatever you want, because that's where a lot of the research comes from. So we are working very hard to make high-cost drugs more affordable, and don't believe big pharma's lies. The fact is the Inflation Reduction Act is working, and we want to make similar things happen at state level.
Wow. Okay. Now let's talk about some things that folks can do. So in Maryland, if they go to Healthcare for All, you can see more details on this, but there's a button, Take Action. And if you click on that, then you can share your story about high cost prescription drugs. And I know that the Freedom Virginia at freedomvirginia.org has a similar campaign. If you're in Virginia, you can click on the Share Your Story and share your story just like Irv did. Now, if you're watching or listening to this and you're not in Virginia or Maryland, a great place to go is Pay Less for RX.org, which is also part of the FamiliesUSA.org website. And but tell me, these campaigns, what is the outcome that's going to occur if we can, get the word out and get people sharing their stories?
Mm-hmm. So if we're able to pass a prescription drug affordability board, it would be an independent board of experts who are able to meet and set price caps on or cost caps on the price of drugs. So they would have a certain amount per year. It's not just every single drug is going to suddenly get a lot cheaper. They would be looking at 10, 12 drugs a year and setting those cost caps, being able to take in all the information that we have about our system into account. So it's just a really fair kind of oversight that protects the consumer. And I would love to talk for a minute actually about what happens once you share your story. I think sometimes people wonder, what are you doing with these stories? How do they help? It's really important for us to be able to bring the perspective of constituents to their legislators. That's how we get them to listen and really understand the facts, because you can throw statistics at them all day, but that's not going to resonate the way someone's personal story will. So I have an example here, actually. Every year we take people in person to Richmond to be able to talk to their legislators while this subject is being debated. But we also have a storybook that we put together that's a compilation of many different stories from people all around the state, just kind of showing the breadth of this issue and how it really impacts people of all backgrounds, all ages in their lives, and how having drugs be more affordable would really be beneficial to everyone.
Man, this is great. Now, here's the heartbreaking thing that I'm thinking about is that somebody may be tuned into this and they go to your websites and they share their story, but they really need help right now. I mean, the fact that they're sharing their story and that this can impact change in the future is fantastic. But do y'all have any resources or connections?
Yes. In Maryland, we do. Now, first of all, I just want to say first of all, emphasize that what Virginia is trying to do, what we're doing in Maryland, is not some unique, outrageous thing. Every other industrialized nation does something like this. In France and England, they don't pay whatever big pharma tries to gouge them with. They say, you could charge $100, we're paying 20. And pharma takes it, and they still make a lot of profit because it's only cost them $1 to make it. But my point is, what we're trying to do is reasonable. It's being done around the world, and we should do it. And your question is very important, Steve, about someone who needs help right now. Our Prescription Drug Affordability Board is in place, and it's got a terrific membership chaired by former Health Secretary Van Mitchell and a terrific executive director, Dr. Andrew York. You could go to their website, pdab.org. If you're a Marylander, no, pdab.gov, sorry, pdab.gov. pdab.maryland.gov. You'll find it that way. pdab.maryland.gov. And on there is a way that you can tell them your story, and they can help you potentially with, sometimes there are free drugs available in different places, and there are entities trying to help people in those situations. We need these PDABs because this is a systemic problem. But if you're in need right now and you live in Maryland, go to pdab.maryland.gov.
Okay.
And I would say we don't have the PDAB in place yet, but when we connect with people and talk to them and learn about their story, we're often able to connect them with resources in the area that we can go to ask for help. We're networking with a lot of different health institutions to try to, get information from them and share some of our own information. So we have those connections. It's also really helpful to go to your legislator sometimes with these issues. Especially, we have some that come from a healthcare background, so they might be able to sit with you and say, no, that's not right. You shouldn't be paying that amount. I'm going to make a phone call and we'll get you connected with someone who could help you figure out a voucher or a way to go to a free clinic or something.
Yeah. And then, so I've got the PDAB, in Maryland. So folks, if you're listening to this in Maryland, this is a great resource. But if you're in other markets, try to type in Prescription Drug Affordability Board. Your state might have something like this. I'll put in a plug for the area agencies on aging.
Well, let me just for only 3 other states
Oh, wow.
that have really strong PDABs that are working: Minnesota, Colorado, and Washington.
Okay.
None of them have yet implemented upper payment limits, were called, on high cost drugs. Oregon has a board that doesn't have the authority yet. This is something new, and it's not easy to do. In Virginia, we thank your General Assembly for passing it. Unfortunately, Governor Youngkin vetoed it. Very sad. People should contact him and tell him that was a bad thing to do. But we in Maryland were the first to enact these laws, and we hope they can be enacted all across the country.
Wow, this is really innovative, and it's exciting to hear the groundbreaking efforts in Maryland for sure. Okay, well, I think. Oh, and what I was saying is, I was also saying for folks that are out there that they tuned into this and their concern is right now. Number one, reach out to these websites that we referenced, but also area agencies on aging are a great place to go as a clearinghouse for resources, and they may be able to connect you with. So just do a search for your local area agency on aging and let them know what's going on in your region.
Or Steve, AARP. In Maryland, AARP played a critical role in getting our law enacted. Hank Greenberg, the head of it in Maryland, was terrific. I know they're very active in Virginia. All over the country, AARP plays a big role in advocating, and they can also help people, direct people who have present needs.
Okay, this is great.
So, Steve, I really appreciated with this opportunity, and I agree with Vanessa and Vinny about contacting your legislators. But what the thing is remarkable is how many people who are in my situation are really not fully aware of these benefits of the Inflation Reduction Act, that they should see it when they go to the drugstore and pick up their prescription, something which used to cost them $100, $500, just the copay. Now it says zero. Well, they should be shouting from the rooftops about this benefit. Not to mention anyone who would be voting for someone who may jeopardize that, you shouldn't be voting for them. But for those of us who are not on Medicare in this situation, you should contact legislators, but you should have an expectation. You should be demanding that of your legislators that this is feasible, as Vinny and Vanessa has said. So they should be doing this for you. No one should be in a situation where you have expensive drugs and have to pay so much out of pocket. But the individual has to expect that. They have to demand that of their representatives. And the more that you can do that and unite yourselves in voting for it, the more likely it will be that these benefits will extend to all. So it's up to us to get these programs by demanding it of our legislators.
Wow, thank you so much. Personally am grateful for the work that all of you have done. This is just really important. I had no idea that these programs existed, and I'm out there in the world of healthcare and senior living. And so I agree with you. We need to really get the word out. And I really wanted to make sure that we had this conversation before our national election, because this is a really hot topic that folks can do a little bit of research on your legislators and elected officials and see what their stance is on this topic. Would you agree with that?
Oh, absolutely.
Absolutely. If you're a Marylander, let me just say there's a very important Senate race happening right now. And between County Executive Angela Alsobrooks, a Democrat, and Larry Hogan, the Republican. And we're a nonpartisan organization. And we have Democrats and Republicans who support us are great. I want to make sure folks know that Larry Hogan was our previous governor. He was governor when our PDAB was enacted. He let the original PDAB become law without a signature. Then he vetoed a critical funding bill, taking the side of Big Pharma against our people. And that delayed what the board could do for a couple of years. People need to know that. And they need to know that President Joe Biden and Vice President Harris are the ones who got the Inflation Reduction Act in place that's helped Irv so much and millions of Americans.
Man. All right. Well, this has been great. I thank you all for your time. I will do my best to get this out in as many places as possible. And if you're listening to this, feel free to share